We're fighting wars. We can't take care of daycare. You got to let a state take care of daycare, and they should pay for it, too. They should pay. They have to raise their taxes, but they should pay for it. And we could lower our taxes a little bit to them to make up. But it's not possible for us to take care of daycare. Medicaid, Medicare, all these individual things, they can do it on a state basis. You can't do it on a federal. We have to take care of one thing, military protection. We have to guard the country.
President Trump, during an Easter luncheon closed to the press on Wednesday, suggesting that states should fund social safety net programs rather than the federal government. That video was briefly posted online by the White House before it was deleted. But MS Now obtained the video after another reporter downloaded and shared it. White House Press Secretary Caroline Leavitt didn't deny the video's validity, but said the media was taking the president's comments out of context. Let's bring in MS Now senior medical analyst Dr. Vin Gupta. Doctor, what do you make of the president's comments, coupled with the fact that cuts to Medicare by the Republicans' so-called one big, beautiful bill?
Jackie, good morning. I'm worried that the president's comments, might believe the fact that he doesn't believe in a strong, robust Medicare and Medicaid set of programs for the country. One, because it's not. Number two, it's not actually operational. Right now, the federal government, Jackie, entirely runs Medicaid. That was created under the Social Security Act, payroll taxes, federal revenues, bankroll it. In the case of Medicaid, it's jointly run between the states and the federal government, but the federal government still provides about 70 to 80% of the actual economics, the finances to support Medicaid. And so it would take an act of Congress, one, to make that switch. Two, I think really critically, if states are now to tax their citizens, states that have more resources, Jackie, would be able to provide better benefits than states that have lesser resources. And we know that that's going to impact red states and purple states more than blue states. And so this it operationally doesn't make sense. It felt like something that he was just riffing on, but it would mean a significant change to what healthcare looks like. And so it seems like one of those comments that was made off the cuff without really thinking about it.
Something we'll be following closely, but I want to ask you about another topic before we're out of time, which is the exciting news for people who are needle phobics. That the FDA approved the Eli Lilly GLP-1 pill this week. It's now going to move on to the next regulatory phase. Can you talk about what this means for accessibility and any potential barriers to ultimate approval that this pill now faces?
So it got FDA approval, which is fantastic. So this means that this will be accessible to Americans in our market, which is great, because when you think about access right now, I had a chance to speak to the chief scientific officer at Eli Lilly earlier this week. 1 in 10 people across the country, across the world, currently have durable access to a GLP, these new weight loss drugs that we're really excited about, because they mean something different for people battling obesity, cardiopulmonary or cardiovascular disease more broadly. Number two, Jackie, what's really interesting is that for those that are needle phobic, for those that perhaps just have moderate goals when it comes to weight loss, this pill has been shown to be very effective. So maybe you start on this pill, maintain yourself on this pill for a period of time. Maybe you start on an injectable and then wean to the pill, but there's a lot of different use cases for this. And I think we're going to enter this world of primary prevention, where people start to take this pill to prevent heart disease and other complications instead of secondary prevention, preventing another heart attack or a stroke.
And I guess now we'll be watching for how much this comes on the market for cost-wise. But MS Now senior medical analyst, Dr. Vin Gupta, thanks so much for joining us this morning.